El COVID-19 sigue impactando a nuestra comunidad. Estamos ayudándote a mantenerte sano. Gateway Community Health Center está ofreciendo vacunas contra el COVID-19 sin costo. Visita cualquiera de nuestras clínicas y vacúnate. Las vacunas están disponibles sin costo para adultos y niños mayores de 6 meses de edad. No necesitas hacer previa cita, simplemente visita cualquiera de nuestras clínicas. Para más información visita gatewaychc.com o llama al 956-795-8100.
Welcome to Gateway Today, the show that takes a deep dive into the heart of Gateway Community Health Center. I'm your host, David Cash Vasquez, and today we're jumping into the world of pediatrics at Gateway Community Health Center, and our journey will explore life-changing work of pediatric healthcare professionals. First, we'll stop in with Dr. Pedro Castañeda on the evolution of our pediatric department and talk about his practice of medicine since 1976. Plus, we get frontline insights from pediatric nurse practitioner Megan Burns, who will talk pediatric care and services we offer here at Gateway. Then we head over to our South Clinic and chat with Mayra Garza, a certified physician's assistant, who will take us through our one-stop shop for pediatric care. But the pediatric party doesn't stop there, because we head over to our North Clinic with Dr. Rachel Del Fabro, who will illuminate the critical issue of pediatric diabetes. We've got a lot to cover, so join us as we explore the passion, dedication, and expertise that make our pediatric department a pillar of Gateway Community Health Center. Sit back, relax, and kick your feet up. Another installment of Gateway Today starts now. Welcome to Gateway Today, the show that talks all things Gateway Community Health Center. And today we're focusing on a topic that touches us all, either directly or indirectly: pediatrics. Let's explore the tireless work of our professionals who ensure the health and happiness of our little ones. And our journey begins with Dr. Pedro Castañeda, a stalwart in the field of pediatrics here at Gateway. Dr. Castañeda tells us about the development of pediatrics right here at Gateway Community Health Center. All right, ladies and gentlemen, we are here at our pediatric department with one of our legends in the medical world, Dr. Pedro Castañeda. I know you laugh about that, Dr. Castañeda, but it really is an honor to speak with you about pediatrics and really ask you about your beginnings in pediatrics and how you sort of came into Gateway. Tell me a little bit about that. You started in 1976, right?
I started practice in 76. I was the second pediatrician here, and I practiced until 2015. I was on the board for Gateway for about 15 years before 2015, and I retired in 2015 at my wife's insistence on taking care of the grandchildren, and I was at home for 1 week, and Mike Trevino called me from here that they needed a pediatrician, and says, I'm going. And I've been here since 2015. Been very
and you know, your activeness within the organization, from board member to now our pediatrician, taking care of all the different cases that we see in pediatrics. How has it grown from 2015 to where we're at now? What's been the evolution of pediatrics here?
We have grown tremendously here. And here, I see children from birth until they're 21 years old, okay? My special kids, autistic, Down syndrome, neurologically impaired, I see them. I have a 35-year-old kid with autism that I still see. We have a comprehensive care here. We do the vision and hearing. We do the vaccinations. We have a lab. We have a pharmacy. We have psychologists. We have psychiatrists. So it's a complete. And since I've been here, we have been increasing the load from just the word getting out, from our patients that are happy being treated as a whole. Our waiting time here is about 15 minutes. We see them within 15 minutes of coming here. So they like that. We appoint, and we also have walk-ins. The other big thing about this is that the walk-ins are welcome. So if they don't have an appointment, they come in and they get appointed. So
yeah, ease of care, one-stop shop when it comes
Exactly.
to pediatrics. For the parents looking for a place to bring their kids, how do you set them at ease when they're that first-time patient or they're just thinking about pediatricians or pediatric care? What do you say to those parents?
Well, we tell them what's available here, and we tell them how well the nurses take care of the kids. We also stress that we have Saturday clinics and that we have night clinics. So if they don't miss school, they can come in. They can come in at those days. And they've been very amenable to that. They like that idea.
They like the flexibility,
Yes,
I
sir.
think.
Yes, sir.
And you know, with your time in pediatrics, before we kind of got on camera, the fun question is, how many children have you serviced in South Texas?
It's amazing. I don't know. I couldn't tell. When I got here, we went to all the deliveries. We went to all the emergency room visits. So I couldn't tell.
The man is a legend. He I think he's humble about it. But Dr. Castañeda, no, I thank you for providing that care and a little bit of a history on Gateway's pediatric department. And if you want comprehensive pediatric care for your child, we invite you to start your journey at gatewaychc.com. Come visit Dr. Castañeda and the rest of the staff. They're ready to take care of your kids right now. Our thanks to Dr. Castañeda. I had a super fun time with him, and we thank him for his insight. Now let's shift gears to the front lines of pediatric care. Megan Burns, a pediatric nurse practitioner, joins us to shed light on the day-to-day challenges and successes she's seen in the field. All right, ladies and gentlemen, we are here at Gateway Community Health Center, one of our pediatric examination rooms with our pediatric nurse practitioner, Ms. Megan Burns. And Megan, I wanted to ask you about that specific designation, pediatric nurse practitioner. What does that mean for, our pediatric population, parents of our pediatric patients watching or may want to become a patient? What does that mean to them?
So I'm an RN, but I also went and got my master's degree in nursing. I specialized in pediatric care, so I see pediatrics in a primary care setting and see anywhere between patients between the ages of 0 and 18.
And for the parents watching, what services are we able to provide here at Gateway Community Health Center for our pediatric patients?
So since starting at Gateway, one of the things that I loved about it was it's kind of a one-stop shop. We have access to lab, we have access to pharmacy, we have access to other healthcare services like behavioral health, nutrition, and all of that is so important when we deal with preventative health, which is one of the main goals of pediatric care. So we will see patients for their annual physicals on a yearly basis. We see them for consults, meaning sick visits. So if you wake up in the morning and you have fever or cough, then you can absolutely come in and be scheduled. You can also come in as a walk-in, meaning that you don't have to have a scheduled appointment. You can come in. We try to get to everybody as best we can. And if not, we have night clinic services, kind of like an urgent care, and even services on Saturdays.
That's awesome. And I'm glad you brought that up, the one-stop shop, because it allows a parent, I think, to get a full comprehensive overview, right, of a patient. So tell me about that. What are you seeing in terms of patients specifically here in, South Texas? From the patients that you're seeing, what are you dealing with a lot of?
Right. So for example, one of the things that we saw, especially during the pandemic, and as we kind of come to a close with that time now, is we saw a lot of people that missed their physical appointments. So we had a lot of kids that, because they weren't going to school, were either backed up on their vaccines, so they were delayed or they were missing certain essential vaccines. We're also seeing a lot of levels of maybe depression and anxiety because we spent basically 2 years in isolation. We're also seeing maybe a little bit increased levels of obesity because of the same reason. We were stuck at home. So what's nice about coming is, one, we can catch you up on either missing vaccines, but we can also do the necessary assessments to determine if blood work is necessary, or just screening tools that we use to kind of just see how you're doing overall. What's nice, and going back to the one-stop shop, is that if we do feel like something's necessary, we can do everything here. So you can come and see me, Dr. Castañeda, any of the other providers at the other clinics. We can order what we need to order, and it can be done before you even leave the building. Once we get results, then we can kind of follow up and do things from there.
Yeah, so for LISD, UISD students, right?
Yes.
We provide all the vaccines, but what I wanted to also ask you about was the telehealth, right?
Absolutely.
And this is the ability for parents to basically get sort of seen, or their child seen, even before they leave school, right?
Absolutely.
So tell me about that.
Yeah, so one of the things that we offer is when you register your child for the upcoming school year, you can designate or just say okay to becoming a patient of Gateways. And what that does is if your child were to ever visit the school nurse for anything like fever, or if they're not feeling well, you can opt to have a telehealth visit with a provider here at Gateway. From there, we can determine if medication is necessary or what needs to be done to make your child feel better. Parents are their children's best and biggest advocate. And when you either feel like something's wrong or you have a concern about the way that your child is growing, developing, their health in general in any way, we're here to serve the community. We see patients day in and day out. We try to spend as much time with them as possible. One of the things that I'm proud to say is I try to not have my patients wait a long time. Sometimes the pediatricians and everybody gets busy, or we're waiting in the emergency room and it can be hours and hours. But if I can answer your question in a quick way, then we're here to serve the community as best we can.
That's awesome. Well, hats off to you and all of the pediatric department that just continues to serve our community. I thank you for your time. Her name is Megan Burns. She's a pediatric nurse practitioner. You can visit her or any of the other staff here at Gateway Community Health Center simply by going to gatewaychc.com. Get checked, get access, do it now. Our pediatric department continues to get better thanks to the hard work of people like Megan Burns. Our thanks to Megan for her insight. Well, one-stop shop for pediatrics. Have you heard of it? We're doing it here at Gateway. Let's talk more about that with Certified Physician's Assistant Mayra Garza as we head to our South Clinic for that discussion. Ladies and gentlemen, we're here at the South Clinic with Ms. Mayra Garza, a physician assistant who specializes in pediatric care. And Mayra, thank you so much for your time. Appreciate
you, David.
Taking time out of your busy schedule. We were talking off camera about how crazy your schedule is in terms of the amount of patients that you're seeing. And you've been doing this for 10 years, right?
Yes, 10 years at Gateway.
So tell me about that experience in pediatrics and what you've learned in working with parents and patients, and when they get here. How do you put them at ease when visiting with these patients and parents?
I try to just talk to them like if it was my family. And I think you touched on it earlier that I kind of joke around a lot because I joke around with them too.
Yeah.
And the kids are what make it fun. So they're what keeps me coming back. And I've had babies that are teenagers. I'm on second generation too. I've got patients that are now bringing me their babies. And so it's been really nice and rewarding.
Yeah, definitely a rewarding experience, I'm sure, for the patient. And in terms of rewarding the patient, talk to me about overall care, right? I always stress the one-stop shop on Gateway today, but tell me about that for a patient that you see and giving them comprehensive overall healthcare.
Well, here we do physical exams, vaccines. I will see them for sick visits. We accommodate for walk-ins. You know, you don't always know when you're going to be sick, and I hear that other clinics are just very, very busy and they can't get a same-day appointment. So we do offer same-day appointment and services and walk-ins. We have the dental department for all of our little ones. We have the nutritionist, which I try to use a lot because they have so much knowledge to give us. Things that we may think are normal may not really be the healthiest thing for us. We have our counselors here, because that's also been an issue now, especially after COVID. A lot of kids are very anxious getting back into the crowded schools when they were just at home for 3 years. Right. So now we're doing x-rays, right? Yeah. And sports medicine, and
the list list keeps on sort of growing, right? To give overall comprehensive care. Let me ask you that. one little piece there is, how do you see that communication sort of happening between departments?
Okay.
How have you seen it sort of improve in the 10 years that you've been here with Gateway?
Well, we have grown a lot. When I started here, there was only 3 clinics. I think we're on 6 now. We'll call each other. We will tiger text, which is the private text message between providers. I can walk over the counselor's office and knock on her door and tell her I have, an emergent case or I really need you. Same with dental department. I can just go upstairs and see if we can accommodate somebody quickly.
That's awesome.
Yeah.
And you have that open door policy between providers, and I love that you're able to do that. This is the fun question.
Uh-oh.
What's your favorite part about your job? What do you love about pediatrics?
It's the kids. They say silly things, and some of them are not good things, but they're funny things. And I just, you see a little baby and you want to make sure they're okay. And I do it for the kids.
Absolutely.
They're what keeps me coming back. Pediatric was my calling.
I love it. And if you want to be a part of that calling, you want to experience high quality healthcare right here with Myra, come visit her here at our South Clinic, and you can start your journey simply by going to gatewaychc.com and get the best comprehensive healthcare for you, your child, right here at Gateway Community Health Center. It's not just doctors and nurses who make our pediatric department tick. Myra Garza is a key part of our one-stop shop for pediatrics. When we come back, we will discuss pediatric diabetes with Dr. Rachel Dalfabro. So stay close. Gateway Today returns in just a moment.
COVID-19 is still impacting our community. We're helping you stay healthy. Gateway Community Health Center is providing vaccines at no cost to you. Visit any Gateway Community Health Clinic and get vaccinated. Vaccines are available at no cost for children 5 years of age and older and adults. Get the vaccine today to help our community stay healthy. Walk-ins are always welcomed. Simply visit any of our conveniently located clinics. For more information, visit gatewaychc.com or call 956-795-8100.
Welcome back to Gateway Today. Well, before the break, we left off on the difficult topic of type 1 and type 2 pediatric diabetes with Dr. Rachel Dalfabro, a pediatrician who has spent years researching and treating these patients and is here to help us understand more about type 1 and type 2 within our pediatric population. Check it out. All right, ladies and gentlemen, we are here at our Shiloh North Clinic with our pediatrician, Dr. Rachel Dalfabro, to continue that conversation about pediatrics and specifically diabetes within our pediatric population. And Dr. Dalfabro, thank you for joining us on this episode of Gateway Today. I wanted to ask you about type 1 and type 2, and really to tell me the difference between the two within our pediatric population and how we know those differences.
Okay, so type 1 and type 2 diabetes are the most common in kids. Type 1 diabetes is pretty much an autoimmune process where you're going to have the destruction of the beta cells of the pancreas, which are the cells that produce insulin. So pretty much your body is going to destroy the capacity of producing insulin. So the treatment for that would be pretty much administering insulin, getting insulin from outside and putting back in your body. Now, type 2 diabetes, it's a combination of resistance to insulin and also the secretion of insulin is not appropriate. So you are going to have insulin, is just not the right amount, and it's not, your body's not going to respond to the insulin as well. So for type 2 diabetes, you don't necessarily need to give insulin. We can do other things to manage that type of diabetes. And then you're going to see difference in the way that the patients are going to present as well, right? So in type 1, because you're not going to have insulin at all, those patients are usually younger and they're going to present with more symptoms. So if you have no insulin, the symptoms that we usually see is increasing thirst, increasing urination. Kids might lose weight, they might be very hungry. We can have other symptoms like headaches, nausea, vomiting. So you see more symptoms in kids when they present with type 1. Not always, sometimes you're able to pick it up before, but usually kids with type 1, they're gonna have symptoms. Now, type 2, because it's a more gradual process of resistance to insulin, just to go back a little, resistance to insulin is gonna be caused by overeating, sedentary lifestyle, the resulting overweight and obesity. It's a more gradual process. So those kids usually, they don't have any symptoms of the type 2 diabetes. And the way that we catch those kids, that we diagnose them, is by doing routine blood work and trying to identify risk factors to diagnose them.
And that's kind of what I wanted to talk about and let the audience know, which is the type 1 is inherent, right? Or something that
So there's a strong genetic, association. So we know that families where type 1, is prevalent, or kids that have other autoimmune problems, they have an increased chance to have type 1 diabetes. But also type 2, if you have a family that they say like, oh, diabetes runs in my family, a lot of times that's type 2. And you have a genetic component as well. So for both of them, you can have a genetic association, but not everybody that has a family with type 1 or type 2 is gonna, have diabetes. Type 1 is more like an autoimmune process, and type 2 is more related to your lifestyle plus genetics as well.
And that's what I wanted to touch on next was modifications, right? And sort of how we can prevent type 2 or even just, hope to avoid getting that within our pediatric population. How do we do that?
Yeah, so for type 1, right now, we don't have any way to actually prevent type 1 diabetes. It's an autoimmune process. Of course, we can identify risk factors and symptoms and be aware that, it's something that exists. But type 2, we do have better ways to prevent the development. It doesn't mean that if you do everything right, you're never gonna have type 2, but we have ways to kind of avoid as much as we can. So because type 2 diabetes is caused by our resistance to insulin, it's caused by the overeating, sedentary lifestyles, excess weight, if we manage those risk factors, we can avoid progressing to diabetes, right? So, for example, we always talk prevention. It's the nutrition, the exercise, right? The sedentary lifestyle, avoiding that, and weight management, right? So just to talk a little bit about those three things. So nutrition, very important to eat the least amount of processed foods that we can, avoid sugary beverages, avoid eating fast foods, increase the intake of fruits, vegetables, the real food, right? So food that it's made at home, cooked with ingredients that are fresh. This is very important. Having a nutrition assessment is something important as well. So for our kids that we see increased risk factors to develop diabetes, we can refer them to have a nutrition assessment. The other thing, exercise, also very, very important. So even if you don't lose weight, it's known that exercise and keep yourself active can help with the insulin resistance. So even if you don't lose weight, just by exercise, you can help your body use this insulin in a better way.
And I think that's important for parents to understand, because parents have the control over their children's diets, their children's activity. And so parents, if you're listening to the pediatrician, vegetables, exercise, no junk food, or limit the junk food, can actually decrease our chance of getting type 2, right?
Yes,
so
correct.
for the parents out there that are kind of wondering, how can I protect my child? Or I have questions of my child has displaying symptoms of diabetes. What do you say to those parents?
Okay, so first, it's very important for parents to bring their kids for their physicals, right? So if your kid is doing okay, it's still important for you to take them to their yearly physicals for us to know if they have risk factors, we can screen them. And the way that we screen is by a physical exam. There are some signs of type 2, one that I forgot to mention, but it's like one that it's important is what we call the acanthosis. It's the darkening of the back of the neck. Sometimes the armpits get a little darker. That might be a sign of insulin resistance. We can identify that in the physical exam. We are gonna check their weight, their height, see if it's appropriate. If we see any risk factors, we can check the blood to see if there is an elevated sugar there, right? So the key for us is to catch those kids before they are actually diabetic. So when the sugar is a little high, but not too high, so we can identify those kids and start interventions, right? So it's never, I don't like to talk about forbidden foods. It's more like foods that we can eat more and foods that we have to limit, right? So the junk food, fast food, cookies, chips, those should be in smaller amounts, and fruits and veggies should be more, right? So this discussion is very important.
I think some parents are breathing a sigh of relief, right? Because everybody loves a little sweet every now, right?
Yes, every now and then, there's no problem.
For treatments, right? Medications, advancements when dealing with type 1 and type 2. What are you seeing out there through your research and through everything that you're seeing within the population? What are you excited about in terms of how we're going to be able here at Gateway to treat those patients?
Yeah, so remember the type 1 and type 2, there are two different problems, right? So for type 1, the treatment, because we don't have insulin, the treatment is to give insulin. Nowadays, we have more modern ways to monitor both the glucose and the way that we're going to give insulin. So we have now monitors that we can put on the skin that can keep monitoring the insulin, the glucose. So kids not necessarily need to be poking their fingers all the time. So that's one thing that is more advanced now. We have the insulin pumps. They're there for a while already, but they're getting more and more modern. So the insulin pumps are going to administer the insulin for you, so you don't necessarily need to inject yourself all the time. Now for type 2 diabetes, the main thing first is to make sure that we exercise and control our weight, the diet and everything. But for kids that the diabetes is more, let's say, advanced and the sugars are higher, we are going to start medication, right? So if it's very, very high, those kids might need insulin, but most kids do not with type 2 diabetes. We do have medication by mouth. It's called metformin. It's a very common medication. It was the only one for many, many years that we could offer to our kids besides insulin. For the last 5 years, we have some new medications that have been approved for kids. Medications that were used for the adult population for a long time. Now they're being approved in kids, the injectable ones, the ones that are famous for weight loss. For example, Victoza is a medication that it's now approved for kids. So we are very excited that this is another option, another layer of intervention that we can do for those kids.
And all available through our pharmacy, right?
Correct, yes.
Awesome, and that's great news for parents because again, Gateway is about all that 100% comprehensive care for your child, and our hats off to you for continuing to treat our pediatric population. Dr. Rachel Dalfabro, our pediatrician here at our North Clinic on Shiloh. Make sure you come and visit or start your journey at gatewaychc.com. Dr. Dalfabro, thank you for your time.
Thank you very much, David.
And thank you for watching another episode of Gateway Today. Dr. Dalfabro's work and passion is truly inspiring, and we thank her for sharing her knowledge with us. I wish we had more time, but our work to support our pediatric patients and their families will continue off camera as this episode comes to an end. It's been an enlightening journey through the pediatric department of Gateway Community Health Center. We thank all of our guests and their dedication to our children's health as it is in skilled, caring hands. Don't forget that if you would like that same care for yourself or your child, please visit gatewaychc.com to become a patient today. Remember, we accept all insurances, including Medicaid and Medicare, and even serve those without any coverage, no matter your ability to pay. Our doors are open to all for high-quality medical, dental, and behavioral health care. No appointment is necessary, and you can simply walk into any of our clinics. We remind you that if you'd like to catch a full rewind of this episode and all other episodes of Gateway Today, please head over to our YouTube channel, and don't forget to smash that subscribe button. Our thanks to you again for watching this installment of Gateway Today, and remember, your health is your wealth, so take care of it.
COVID-19 is still impacting our community. We're helping you stay healthy. Gateway Community Health Center is providing vaccines at no cost to you. Visit any Gateway Community Health Clinic and get vaccinated. Vaccines are available at no cost for children 5 years of age and older and adults. Get the vaccine today to help our community stay healthy. Walk-ins are always welcomed. Simply visit any of our conveniently located clinics. For more information, visit gatewaychc.com or call 956-795-8100.